Welcome to the Abdominal Transplant Center at Dell Seton Medical Center at the University of Texas. I'm Katie, the Living Donor Coordinator. In this video, we will go over some educational information on what to expect prior to your living donor evaluation. You are considering having major surgery to give one of your kidneys to another person. Please listen carefully as we educate you on this process. Informed consent is how we, your team, will communicate and educate you on the living donor evaluation process to ensure that you are making an educated decision to donate or not donate that is free from coercion and inducement. The Living Donor Program will be offered to patients who have been fully informed, who understand the risks and benefits, and have signed the informed consent. There are several advantages to a recipient of a kidney from a living donor. Those who receive a kidney from a living donor typically receive a better quality organ that typically functions immediately and lasts twice as long as a deceased donor kidney. There are alternative therapies for treatment of end-stage renal disease if you are not able to or choose not to donate your kidney. The recipient may get a deceased donor kidney from the waitlist. They may choose to remain on dialysis or seek out another living donor. Certain pre-existing medical or surgical conditions in the recipient may affect the success of a transplant, such as diabetes, high blood pressure, and heart disease. Your living donor evaluation will occur in one day. The purpose of this evaluation is to determine if you are a donor candidate. You will undergo blood tests and imaging for your initial evaluation, but other tests and/or consultations may be needed to determine your candidacy. You will have the opportunity to meet and interact with your donor team. This will include your living donor coordinator, transplant nephrologist, transplant surgeon, social worker, pharmacist, dietitian, advanced practice provider, and others. You will also meet your independent living donor advocate, or ILDA, whose main priority is to help you understand and answer questions about the informed consent process to ensure your rights are protected and your decision to be evaluated and/or donate is free of inducement or coercion. The costs directly related to the evaluation testing and physician consults, as well as the donation surgery, are the financial responsibility of your recipient or the transplant hospital. You may incur incidental expenses pre- and post-donation, such as parking and discharge medications and complications. Post-donation complications are rare and coverage varies by payer. Additional evaluation and/or any treatment for any condition identified during evaluation will be your financial responsibility. Throughout the evaluation, we as your donor team treat you as a separate and distinct patient from your potential recipient. The decisions about your candidacy are made independently of the decisions regarding your recipient. Your information may be shared with members of the kidney and pancreas transplant program, the donor team, and/or the independent living donor advocate. We take all reasonable precautions to provide confidentiality for both the living donor and the recipient. Limited information, including transmissible diseases, cancer, and other results that may affect the health of the recipient, will be shared with both the donor and the recipient. Information will also be shared with local, state, and federal agencies as required by law. If you choose to discontinue the evaluation process, your reasons for doing so will not be shared with the potential recipient. Taking part in the Living Donor Program is voluntary. You have the right to stop your donor consent or evaluation process at any time during the process in a way that is protected, confidential, and without penalty. It is important that you are coming to us willingly, free from inducement, coercion, or pressure. You do not have the right to receive any payment or anything of value in exchange for being a donor. It is a federal crime for any person to knowingly acquire, obtain, or otherwise transfer any human organ for anything of value, including but not limited to cash, property, or vacations. Health information obtained during the evaluation could reveal conditions like infectious disease or malignancy that is pertinent to acute recipient care. These conditions may be reported to local, state, or federal public health authorities, the recipient's transplant hospital, and the OPTN Improving Transplant Safety Portal. We also have to provide organ donor and recipient information to the United Network for Organ Sharing, or UNOS, who oversees the donation and transplantation system in the United States. Information may include name, birth date, gender, social security number, and blood type of donor, donor's relationship to the recipient, and some blood test results. This identifying information is not accessible to the public. The kidney is removed laparoscopically through 3 to 4 small incisions in the abdomen and is closed with adhesive glue. You will be in the hospital approximately 1 night and will see the surgeon again within 7 to 10 days. If you live more than 4 driving hours from Austin, you will need to plan to stay in the Austin area for 1 to 2 weeks after discharge. The following surgical, medical, psychosocial, and financial risks are associated with living kidney donation. 1. Acute kidney failure. 2. Scars, pain, fatigue, hernia, and nerve injury, and any other consequences typical of any surgical procedure that the physicians will review with you. 3. Decreased kidney function or kidney failure with the potential need for dialysis. 4. Death. Potential acute medical risks include, but are not limited to: 1. Allergic reactions. 2. Discovery of serious medical conditions. 3. Discovery of adverse genetic conditions. And 4. Discovery of certain medical conditions that would require additional testing. Long-term medical implications of organ donation have not been fully identified. Please listen carefully to the possible health changes with living donation. 1. Risk of end-stage renal disease, although exceedingly low. 2. On average, living donors will have 25 to 35% permanent loss of kidney function after donation. 3. High blood pressure. 4. The medical evaluation of a young living donor cannot predict lifetime risk of chronic kidney disease or end-stage kidney disease. 5. Bloating, nausea, and developing bowel obstruction. 6. For female living donors, the risks of preeclampsia or gestational high blood pressure may be increased in pregnancies after donation. And 7. Kidney donors who become kidney transplant candidates receive higher priority on the kidney waiting list. Potential psychosocial risks may include, and are not limited to, PTSD, anxiety, emotional distress, and feelings of guilt. These emotions may be caused by the possibility that your donated organ may not be used or fails to function in the recipient. In those cases, the recipient may need to remain on dialysis. Potential financial impacts include, but are not limited to: 1. Personal expenses of travel, housing, and loss of wages related to donation. 2. Loss of employment or income. 3. Negative impact on future health insurance. And 4. Future health problems experienced by living donors following donation may not be covered by the donor's or recipient's insurance. Thank you for choosing Dell Seton Medical Center at the University of Texas at Austin and taking the first step to becoming a living kidney donor. Remember, we are here to support you during your evaluation process. Please contact your living donor coordinator with any questions. Once again, we thank you for trusting the Dell Seton transplant team with your transplant care.